of the day. Today I will be presenting release behavior of anti-cancer drug from solid lipid nanoparticles. Cancer continues to be a major global health burden responsible for approximately 70% of death worldwide. One of the biggest limitations is that many anti-cancer drugs are poorly water-soluble, which leads to low oral bioavailability and non-specific distribution. To overcome this barrier, we have explored solid lipid nanoparticle as a novel drug delivery system. Their small size enables them to absorb via pure patches in the small intestine. The SLN enters in the lymphatic system, thereby bypassing hepatic first pass metabolism. This results in improved bioavailability. Category of drug is EGFR tyrosine kinase inhibitor. It is BCS class 2 drugs having bioavailability approximately 60%. PK value is 5.4, log P is 3.2, and having melting point around 193 to 97 degrees Celsius. Drug has extremely low water solubility, which limits its absorption. Although drug have approximately 60% oral bioavailability, a relative high dose of 250 mg is required, which often leads to side effects such as skin rashes, diarrhea, and lung disease. Therefore, there is a need of improvement of absorption. SLN are absorbed into lymphatic system via pure patches into GIT. Objectives were to formulate stable SLN to evaluate develop formulation in vitro drug release, particle size, and PDI to study stability profile of the developed formulation. SLN were prepared by using modified hot melt emulsification technique. The lipid and the emulsifier were heated 5 to 10 degrees above their melting point. Then the drug was added into it. After complete solubilization of drug, surfactant was added. A suitable amount of water with dissolved stabilizer was heated to same temperature and added to lipidic phase. This primary emulsion was vortex for 10 to 15 minutes for proper mixing. Further particle size reduction was done by using prop sonic heater, which has 3 horn and 40% varic and 90 watt power for 10 minutes. Solubility studies various solid lipids such as completol, 888, palmitic acid, vitofasol if 85, sterotex HM, sterotex NF was screened. Among this, palmitic acid showed high solubility for drug X. Solubility study was also performed for the emulsifiers such as Galol palettes, and Softimule 165. Drugs showed more solubility in Softimule 165 as compared to Galol 64 and Galol palettes. Optimization was done by OFAT, one factor at the time. Initially, lipid concentration were varied to arrive at optimal composition. First, palmitic acid concentration was varied from 300 mg of surfactant combination, that is 2 in 80, Softimule 165 and poloxamol 407 were used. Among all the formulation, F3 formulation was stable for 1 month at 25 degrees Celsius. Hence, F3 formulation continuing 300 mg palmitic acid for the for further uh, optimization. For the sonication time varied to check effect on particle size and PDI. It was observed that 10 minutes of sonication resulted in particle size 249 nanometer and 0. Particle size 249.7 and PDI was 0.26, which was lower than that of octane after sonication of 5 minutes. SLN was white translucent dispersion. pH was 6.4, treatment efficiency was 88%, and the assay was found to be 101.0 36%. Particle size was 247 nanometer and PDI was found to be a 0.267. Selection of diffusion media in order to check diffusion of drug in various medium, that is phosphate buffer pH 7.4 with zero point 0.5 1 and 2% of SLS was performed. Media show that good solubility of the drug in 2% SLS, that is 1.329. Further studies are also performed for phosphate buffer in various ratio of methanol. It was observed that 1 is to 2 ratio having a good solubility, which was around 2.63 and 6368. In vitro release was done by using dialysis bag diffusion method. Sample were SLN, drug suspension, drug solution, and the diffusion media was phosphate buffer PS 7.4 and plus 2% of SLS. Media volume was 250 ml, RPM was 200, and temperature was 37 degrees, and it was analyzed by UV by lambda 332. As expected, drug suspension showed low release, and it seemed that drug was rel- retarded in SLN as compared to drug solution. The release study F3 formulation was done in both the methanol and buffer. There was no substantial difference observed. About 72% of drug release observed in 24 hours from SLN formulation when release study was carried out in pH 7.4 with methanol. About 47.4%, 68%, and 83% of drug release was found in drug dispersion, SLN formulation, and drug solution when this release study was performed in pH 7.4 buffer and 2% of SLS. It is always advisable to avoid alcoholic buffer, so it was decided to continue phosphate buffer with 2% of SLN. Release kinetic. To further understand the release mechanism, highest R square value was observed in Crossmere-Pepper's plot. The N value indicate that drug release follows non-Fickian diffusion. The stability study results suggested that the formulation was physically stable for 60 days and there was no color change was observed. There was no significant increase in particle size at 4 degrees Celsius, whereas slightly increase in particle size at 25 degrees Celsius. So strengths are sustained release for up to 24 hours. It is simple, cost-effective, and scalable manufacturing method. Weaknesses are need for long-term stability studies, conversion into suitable unit doses form, and opportunities are strong potential for commercialization and possible extension of application to high value or high to BCS class 2 drugs. Threats are regulatory challenge, competition from other novel drug delivery systems. So conclusion that optimized formulation enables sustained release as compared to drug solution. It has observed that 60% of drug release in sustained manner up to 24 hours as compared to high drug release was obtained in drug solution at the same time interval, and less than 50% of drug release was observed in drug suspension. Thus, developed formulation showed sustained release of the drug. This approach can offers a scalable, effective alternatives to conventional dosage form with potential for better therapeutic outcomes. These are some references. Thank you.